So this part is probably the most important slide. How do we define a dependent adult child? It's not really a term like ADHD or, anxiety. It's more of a category, a descriptor that we're trying to coin right now because we're honestly annoyed and not really fans of the failure to launch. That whole category, that whole labeling seems to imply that, first of all, the concept of failure, which it's not, and also it's kind of a bucket term. And what we want to really designate is the fact that these adult children are very dependent, but they don't have to be, and they potentially, long-term do not want to be. So as children mature into young adults, our hope, of course, is that they increasingly care for themselves, they take on adult responsibility, they function autonomously. However, we have found that severe anxiety, as well as, more disorders that, are sort of outside of the scope of this presentation, but severe substance abuse, very severe mood disorders, and OCD can delay this growth process. However, highly dependent adult children, what they all have in common is that they are developmentally stuck, okay? It's not necessarily that they live at home. I want to really emphasize that. So many healthy adults will choose cross-generational cohabitation for a lot of not bad reasons, not unhealthy reasons. So many adults who are still living in their childhood home can in fact be launched. That's not the criteria. The criteria is high dependence that is emotional, pragmatic, and yes, financial dependence with no path forward, no path towards ending that dependency cycle. So some children might initially launch. Maybe 10 years ago, you were watching webinars here in Attitude Magazine because your child had ADHD and really needed those extra supports, and you got through it and they got to college, but then they backslid and they regressed back into dependence and isolation and overall a less differentiated life. So that is our target audience. These are the adult children that, these sorts of strategies are most designed to help. All right, so I already mentioned that here in this world, the term accommodation is not a good thing. So what is family accommodation of an adult child? So this looks like protecting the adult child from difficult situations. For example, giving them a cush job in the family company rather than having them earn their job elsewhere. And again, it's not the same as like we all work at the family business. The difference is that there isn't that work ethic, that there isn't that striving that comes with the highly dependent adult child. Sometimes the parent is kind of doing more of the work or most of the work in that adult child's advancement. Another thing that I see a lot working in anxiety and OCD is family systems getting modified to align with the adult child's needs. So for example, parents who want to retire and travel the world do not do so because they don't want to cause stress or isolation for their child. We also see with family accommodations that you end up having less of an expectation for the adult child to be really contributing to their own success or really pushing for that mental health support. And allowing for this permanent or semi-permanent dependency without a clear plan. So again, once we have a clear plan like this, you're saving up for this, or we're moving towards that, that becomes a different question altogether. All right. So I am going to assume that most of your adults are anxious. It is a pretty pretty common phenomenon in this generation. And the ability to cope with anxiety is, we're finding is it's less, there's less resiliency, there's less ability to navigate severe anxiety without the support of parents. And so we get into this counterintuitive situation where we have these natural instincts as parents, but they actually will hold our highly dependent adult child back from, sort of achieving what they really could achieve if we were, if we changed our behavior as parents. So one of the things that we, feel sometimes the need to do is rescue or ease our adult child's discomfort, or we might change our lives to better suit our adult child. We might avoid dysregulating our adult child. And so, let's say you were planning on selling the childhood home because the taxes are so expensive, but you don't do that because you believe that that would be dysregulating for your adult child. So basically, you're kind of bending over backwards to make your adult child's life more pleasant. And in doing this, it actually fuels that dependency cycle, right? So that's the tricky thing to say, like, okay, all of these are my natural parental instincts, but what if they were really holding my child back? So we want to, choose things like encouraging your child to face their fears, telling them that they can do hard things, praising resilience rather than sort of heaping praise on achievement, or just, giving praise indiscriminately. And really, honestly, this is the hardest one, is allowing your adult child to fail and recover from that failure. So things that we want to avoid in parenting these adults is constant reassurance, because then you become part of like fueling that cycle, telling them that everything is going to be okay, consistently protecting them from their anxiety triggers, because they do have to encounter anxiety. They do have to encounter their triggers in order to successfully differentiate, in order to successfully make themselves independent. And we cannot help our adult children avoid failure, because that failure might be a necessary thing for their growth, right? A necessary event to help motivate them towards growth.